Patients here refer to themselves as inmates, in chains to keep them from running away. They were committed by their parents or guardians, who also have the authority to set them free. Abraham Muhammad, who has been living here for almost a year, says he feels he has finally kicked a years-long addiction to cough syrup.
Yeah, but when you're here for like a year, get full treatment, the counseling, whatever, etc., you will be able to be strengthened, fully. Even in yourself, you can sit yourself down, tell yourself what you're supposed to do when you're out there in the physical world.
Young men learn welding and how to build everything from pots to sofas. Young women learn to sew and make baby clothes. Lowell Maduru heads the facility. He says patients are treated by psychologists and traditional doctors and counseled by pastors and imams. But he says making enough money to keep the center running is the biggest challenge.
Among the ways we find funding for the center is collecting small payments from parents, which enables us to buy them food, drinks, and their medical treatment.
Maduru says most parents pay $50 a month for their child's care, but many patients are abandoned by their families, making funds thin. Doctors say Maduru's patients are among the minority of people getting any kind of mental health care in Nigeria, mainly because of the stigma attached to mental illness. Moses Ilu is a neuropsychiatrist in Abuja.
When people have diarrhea, they are not isolated. They don't suffer stigma. But when they have diarrhea of words, of vocabulary, you want to isolate them. That is when the stigma comes on.
Because of this stigma, he says, most psychiatric programs in Nigeria are woefully underfunded. And while the treatment may appear unusual here, patients say even the chains on their ankles are meant to help.
It's not just to, kind of molest or maltreat or anything. No, it's for you to be able to know that, wow, freedom is light for which many men died in darkness. Okay, what if I'm able to have this freedom once again? What will I do with it?
Off camera, other patients say they appreciate the skills they are learning at the center, but like Muhammad, what they want the most is to get better and remove the chains. Heather Murdock for VOA News, Kaduna, Nigeria.